Hello, everyone. My name is Jackie, and today I will be presenting with Lisette and V on behalf of the UIC College of Nursing about cervical cancer screening and prevention for women ages 21 and older. We want to take this moment to warn you that we will be talking about content involving female genitalia that some may find rather explicit, and remind you that you have the freedom to watch this video at any time and setting comfortable for you. Our goals for this presentation are for anyone watching to be able to define cervical cancer and its consequences, name at least one benefit of receiving the HPV vaccine, and identify steps involved in a pap smear test. There's a lot of information on these slides, so feel free to pause at any moment to take more time to read.
We have 4 questions that we would like you to think about as we share this information with you. The first one is true or false. Cervical cancer is one of the top 5 most common cancers for women around the globe. The second is true or false. The HPV vaccination can prevent over 90% of cancers caused by HPV, including cervical cancer. The third question is, what is a pap smear and what can it detect? And finally, how often should you get a pap smear?
So let's begin by defining cervical cancer. So it is a cancer of the cervix, which is the lowest part of the uterus. It is the 4th most common type of cancer for women in the world, and more than 95% of cases are caused by the human papillomavirus, or HPV. So HPV is a sexually transmitted infection that most sexually active men and women will contract at one point during their lives. Most cases resolve on their own, but the ones that don't can lead to uncontrolled cell growth, which is how cancer starts. Since West Eldon is a majority Hispanic community, it is helpful to know how cervical cancer affects Hispanic and Latino women. Statistics show they are 40% more likely to develop and 26% more likely to die of this cancer than white women. They are also less likely to participate in routine cancer screenings or tests. This is unfortunate since cervical cancer can lead to many complications, including severe bleeding, kidney failure, or even death. So, how do we prevent cervical cancer from developing? Luckily, there are several options, including vaccinations against HPV and routine pap smears, which have been shown to prevent up to 93% of the cervical cancers. The HPV vaccine can also prevent other cancers of the genital region in both men and women.
Since HPV can affect both sexes, it is recommended that both get the vaccine. It is one series of 2 or 3 doses that are spaced out a few months apart. It can be given as early as 9 years old, before children become sexually active, but can be given up to 26 years of age. It is approved for people up to 45 years of age, but is not recommended since most sexually active adults will have already been exposed to the virus by this time. There is also no evidence that it is unsafe to receive during pregnancy. If you have any questions, the best thing to do would be to ask your doctor if this vaccine is right for you.
Fortunately, most insurance cover the cost of HPV vaccines. If you do not have insurance, there are social workers at the UI Health 55th and Pulaski Collaborative who are eager to work with you to help you get the care you need.
We would also like to take this opportunity to let you know about the Illinois Breast and Cervical Cancer Program, which offers free cancer screening to uninsured or underinsured women of Illinois. Contact information is included in this slide.
Another important aspect of cervical cancer prevention is pap smears. This is a relatively painless exam that will often assemble of cells from the cervix that will be analyzed under a microscope for size and abnormal cell growth. The procedure involves insertion of a metal or plastic tool into the vagina, which will allow your doctor to wheel the cervix and gently scrape cells from your cervix using a small brush or spatula. Results can take up to 3 weeks. If you look at the picture on the slides, you will see, you will get the idea of positioning or process of the pap smear. Routine pap smear are recommended to start at 21 years old every 3 years. You can also receive HPV testing with tests for presence of the HPV virus in the cervix. Starting at 30 years of age, it is recommended to get a pap test every 3 years and an HPV test every 5 years, or you can get both done every 5 years. Once you reach the age of 65, there is no need for screening unless you have history of HPV infection, cervical cancer, or positive HPV or pap test. Once again, the best thing to do is ask your provider what is the best option would be for you. Here are the key points we would love for you to take away from this presentation. Feel free to pause if you would like to review them on your own. For now, let's test your knowledge to see how much you have learned after the information. You can pause or go back in the video to help you answer these questions.
So question 1, true or false? Cervical cancer is one of the top 5 most common cancers for women around the globe. The answer is true. Cervical cancer is the 4th most common type for women. Question number 2, true or false? The HPV vaccine can prevent over 90% of cancers caused by HPV, including cervical cancer. Again, the correct answer is true. This vaccine can prevent up to 93% of cancers caused by the virus.
Question number 3 is, what is a pap smear and what can it detect? The answer is, it is a procedure where the provider will grab a sample of cervical cells through the vagina to examine it for signs of cancer. And finally, how often should you get a pap smear? Once again, everyone is different, but generally, starting at 21 years of age, you should be getting a pap smear every 3 years. Once you turn 30, you can either get a pap every 3 or 5 years, depending on whether you get a routine HPV testing as well. Don't worry if you had trouble remembering this one. What's important is you work with your doctor for personalized testing and treatment.
So this concludes our presentation. We would like to end it by thanking the amazing staff at the 55th and Bolesky Health Collaborative for their support with this project and the amazing care they provide for their community. Here, we have some information about the clinic if you would like to save or share this information with those who may need it. We attach some information for the reference that we use for the presentation. Last but not least, thank you so much for your attention. We hope this information helps you make a healthier and happier life for yourself.